Hello, good afternoon. I am Dr. Sayli Bidkar, Consultant Pediatric Neurologist at Kokilaben Dhirubhai Ambani Hospital, Mumbai. Today we would be discussing about autism, especially the early signs and early clues for diagnosis of autism. So as and when we are seeing the incidence of autism in the society has been increasing, and also the awareness of the autism is also increasing. What does mean by autism, or what autism exactly is? Basically, it is a neurodevelopmental disorder where there is difficulty in social communications with some form of repetitive behaviors. So basically, it's a spectrum of disorder ranging from mild, moderate to severe. What are the early clues for the parents to consider their child could be amongst the autism spectrum disorder and with which they should seek a medical attention? So difficulty in the social communication can be in the form of verbal or non-verbal communication. If you are calling your child and he is not responding to you, if your child is not making good eye contact with you, if your child is having speech delay, or if he was speaking something at 1.5 years of age, 2 years of age, and suddenly he started regressing that speech. If your child has a habit of repeating the same speech or same words again and again, if he makes limited communication with you, if he is not able to express his needs with you, these could be the communication difficulties, or this could be the early red flags for diagnosis of autism. Along with that, kids with autism would have some form of repetitive behavior. It could be some form of repetitive activity like spinning in the circles. It could be just moving to and fro in the same way. It could be just jumping on the same place again and again. It could be some form of stereotypies like hand flapping, hand clapping, or some abnormal movements with the eyes. Then again can be clues towards the diagnosis of autism. Kids with autism, along with social communication difficulties and stereotypic or repetitive behavior, have lot of difficulties in making social interactions. So if your child is preferring to stay alone, if he is not mingling with the kids of his peer age group, if he is not interested in attending the social gatherings, or if he is not enjoying going to the park and playing with the kids, that again can be clue towards the diagnosis of autism. Kids with autism would also have some form of repetitive play like making the tower, solving the puzzles, and doing the same things again and again. Kids with autism has some sensory issues in the form of they would like particular clothes. They won't tolerate if you change the consistency of the cloth. They would have rigid interest about the foods which they are taking. They won't like too sticky foods as well. So these are other signs or other clues towards the diagnosis of autism. We have seen the common clues towards the diagnosis of autism. Autism sometimes can be associated with some comorbidities which can be ADHD, that is hyperactivity, inattentiveness, impulsiveness, not able to finish the task, just jumping from one task to other. Sometimes kids with autism have disruptive behavior. It could be self-harming, or it could be injurious to the parents in the form of slapping, scratching, or pulling the hairs. Some kids with autism may have epilepsy. Kids with autism also can have feeding issues which can be characterized in the form of recurrent vomiting or constipation. Diagnosing the early clues at young age, taking the help of your pediatrician, pediatric neurologist, and starting interventions at early age could change the outcome in significant ways. So if you have any queries regarding autism, we are happy to help you. Thank you.